everyone, and welcome to today's discussion over electrocardiograms, or ECGs for short, and their correlation to cardiac events. By the end of this video, you should be able to identify the phases that make up an ECG, as well as explain the events that are occurring at each of these phases. Once we have completed our overview of the electrocardiogram, we will shift our discussion to conditions that can present abnormal electrocardiograms, how these abnormalities affect the events of the heart, and the symptoms that an individual may produce as a result. If you're ready to get this discussion pumping, let's get started. Here we have a picture of what is considered to be a normal ECG. As you can see, there are multiple segments and waveforms that together compose the electrical events that stimulate a single full repetition of the heart. There are those that are representative of the events of the atria, such as the P wave and PR interval, and there are portions of the ECG that are prevalent to the ventricles, such as the QRS complex, the ST segment, and the T wave. We will briefly discuss each of these components in turn, with details on what they represent and what occurs in the heart as a result. Just like the blood that is entering the heart, we will begin with the atria. To interpret the electrical functionality of the atria, we must look at the P wave and the PR interval. The P wave represents the depolarization of the cardiomyocytes of the right and left atrium. The right atrium is stimulated first, making up the initial rise in the P wave, with the stimulation of the left atrium making up the second half of the wave. The summation of both is what gives the P wave its uniform shape. Abnormalities in the atria would result in morphologies of this normal P wave, which will be discussed later. The PR interval represents the time between atrial depolarization and ventricular depolarization, which also represents the AV nodal delay. During this time, we can observe muscular contraction of the atria. Lengthening or shortening of the PR interval can indicate dysfunction of the sinoatrial or atrioventricular nodes. After the atria have been stimulated, it is now the ventricles' turn. The depolarization of the ventricles is represented by the QRS complex. The small Q waves can result from several events. The first is the depolarization of the ventricular septum. It can also be caused by an individual's breathing or be an indication of a previous myocardial infarction or heart attack. It is possible that an ECG may not consist of a Q wave, but still be considered normal. The largest wave, the R wave, represents the depolarization of the myocardiocytes in the ventricles. This wave is bigger than the P wave due to the larger mass of the ventricles. The S wave is the final depolarization at the base of the heart. The ST segment, or ST interval, is the time between depolarization and repolarization of the ventricles. During this time, the contractile cells of the heart are in their plateau phase, and the ventricles are contracting and emptying. Now that the ventricles have gone through depolarization, they must repolarize. This repolarization is represented by the T wave. Once the ventricles are repolarized, they then enter a state of relaxation where their chambers are refilled. This filling time is indicated by the TP segment or TP interval, which lies between the repolarization of the ventricles and the next depolarization of the atria. Now that we have a better understanding of the segments of the ECG and what is considered normal, let us take a look at some abnormal ECGs, discussing what makes them abnormal and the symptoms and conditions that are associated with them. There are many possibilities of abnormalities in ECGs, but to save time, we will only be looking over a few. We will begin with abnormalities in the electrical activity related to the atria. The top ECG, looking a little erratic, shows a condition called atrial flutter. Atrial flutter is the second most common form of arrhythmia. It is a form of tachycardia that occurs in the atria and can result in the atrial rate reaching 300 beats per minute. The ventricular rate can be either fixed or it can vary throughout the ECG. An individual with atrial flutter would experience symptoms of fatigue, heart palpitations, or syncope, otherwise known as fainting. This condition can also cause an embolic phenomenon, otherwise known as a stroke. Since we have mentioned the second most common arrhythmia, let us take a look at the most common, atrial fibrillation. This is another form of tachycardia that results from abnormal electrical activity of the atria. Due to this high rate in the atria, blood flowing through the heart becomes more turbulent, increasing the likelihood of blood clot formation. Due to clot formation, atrial fibrillation is the leading cardiac cause for a stroke. Symptoms can include a fast heart rate, chest pain, shortness of breath, severe sweating, nausea, and extreme fatigue. In the case of both atrial fibrillation and atrial flutter, there is no distinguishable P waves. Our last ECG on this page is that of a first-degree heart block. This is seen in the ECG as a prolonged PR interval that does not disrupt the conduction between the atria and the ventricles. This can be indicative of heart disease. Most patients with this condition are asymptomatic, but can exhibit symptoms if there is severe elongation of the PR interval. These symptoms include lightheadedness, chest pain, fainting, malaise, and shortness of breath. The chest pain is typically a result of the atria contracting against the closed atrioventricular valves. Now let's take a look at the ventricles. The first ECG on the slide shows tracings for a left bundle branch block and a right bundle branch block. Both of these conditions are caused by a compromised conduction of the His-Purkinje system of the heart. A left bundle branch block is often associated with strain or hypertrophy of the heart muscles, or develops as a result of myocardial injury. This condition is asymptomatic. It can be identified by a wide QRS. It presents either a QS only or a small R wave with a large S wave in lead V1, or it will present as a notched R wave with no Q wave in lead V6. A right bundle branch block is a slow, progressive, degenerative disease of the myocardium. With the interruption of the right bundle branch of the bundle of His, the left ventricle depolarizes first. Then after a slight delay, the right ventricle will depolarize. This condition is also asymptomatic, but it may be a predictor of the mortality in heart failure, myocardial infarction, and certain heart blocks. It also presents with a wide QRS. In leads V1 and V2, you can see an RSR wave. And in V1 and V6, the duration of the S wave is greater than the R wave. The bottom ECG shows a current ischemia or previous infarction. In other words, the tissue of the heart has been damaged. thus decreasing the functionality and efficiency of the heart. The telltale characteristic on this tracing is an inverted T wave. Before we conclude our discussion over ECGs, let us look at one more example. The ECG provided is that of a 32-year-old male whose heart rhythm went into ventricular fibrillation after consuming a total of 48 cans of energy drinks within a 3-day window. The gentleman presented to the emergency room complaining of heart palpitations and a lack of sleep. He appeared to staff to be oriented and fully conscious, with an anxious behavior. Suddenly, his eyes rolled back in his head, became unresponsive, and began to convulse. The electrocardiogram indicated that his normal rhythm, due to the influence of too much caffeine, had turned into ventricular fibrillation. This is a fatal arrhythmia. The ventricles are being stimulated so quickly and repeatedly to contract that there is no longer time for the ventricles to fill with blood. The heart is therefore contracting, but is not pumping blood needed by the body. In the ECG, there are no distinctive waves due to constant stimulation of the ventricles. The hospital staff had to use a defibrillator to shock the heart back into a normal rhythm. Luckily, the gentleman recovered. And that brings us to the end of our brief lecture over electrocardiograms and their correlation to cardiac events. Electrocardiograms allow physicians to determine the efficiency and proper function of the heart. They can help with diagnoses of heart conditions and potentially save an individual's life, like the gentleman who enjoys energy drinks a little too much. Hopefully you found this video informative and supplemental toward your studies. As always, I wish you good luck in the rest of your studies, and have a wonderful day.